Everybody. I'm not going to use the microphone. Can people in the back hear me? I have a pretty heavy voice that carries. Can I get a thumbs up in the back from people that can hear me? Yes? Perfect. All right. So what if I told you that there was a medical intervention that could prolong your life as well as decrease chronic diseases? Would you guys be interested in that? If I said I had a pill that if you took it, it would make you not only live longer, but you would live healthier. Right? Okay. On top of that, you guys are pretty easy to convince, right? I said I had a pill. No one asked, are there any side effects? What if I told you that on top of that, you would live longer, less chronic diseases, and you would have no side effects, not a single one? Is that something that would interest you? I think all of us can agree that that's something that we would all be interested in. Well, my name is Dr. Iftikhar, and today I want to talk to you about the art of longevity. And the hope of this talk is to inspire each and every one of us to take back control of our health and to live a longer, stronger, and healthier life. And the beauty of this talk today is I'm going to share with you a lot of things that each and every one of us can start to implement tonight. It's not anything that we have to wait for, but it's something that each and every one of us can do starting today. So why did I pick this topic of longevity? I think all of us have heard the phrase, the art of medicine. It's something that has been said for decades, maybe even centuries, because practicing medicine is an art form. And my approach to medicine over the last few years has changed a little bit. And there's a reason for that. Now, if you look at statistics, especially in this country, our life expectancy has gone up, and it's at about 77, 78 years of life. But our health span has gone up to 66 years. And the difference between the two is your lifespan is the number of years that you've lived, and your health span is the number of years that you've lived in good health. So when you look at it, there's about a 12-year difference between the years that we're living versus the years that we're living in good health. And the reason behind that is because the incidence and the rate of chronic issues haven't decreased. So the goal of longevity is to obviously maximize the number of years that we're living, but it's also to compress disease, chronic and acute both, in a shorter period of time. Because I think we all can agree, we want to live as long as we can, but we want to make sure that those are good, healthy years of our lives. This is a very, very small slide, and I put this in because I think each and every one of us, if we haven't said this, we've heard someone say something to the effect of, oh, I can't do that because I didn't win the genetic lottery, or mom and dad gave me bad genes. And there are studies that have looked at this, and they've looked at the effect our environmental and lifestyle habits have on our health and our life versus our genetics. And it shows that about our genes play 25% of a role in our lifespan and in our health. And I just want to show this to all of us so that we realize that each and every one of us in this room, we have a lot more control over our health, over our life, and how diseases may affect us much more than we thought before. Also, really quickly, if anyone has any questions, any comments while we're going through this, please feel free to interject. I want to make this as collaborative as possible. And so these are the 5 main causes of mortality or death. I think we all know this. Cardiovascular disease, heart attack, stroke, chronic respiratory diseases, metabolic diseases such as obesity, diabetes, neurodegenerative or cognitive disease. This is things such as things that affect the brain, so dementia, Alzheimer's, Parkinson's, and then cancer. But the good news about all 5 of these things is the first word of the title of this slide. Each and every one of these things is modifiable. And we're going to go over in more detail the key aspects and pillars on how we can modify each and every one of these. So this is going to be the focus of my talk today, the 5 pillars of longevity: diet, nutrition, physical activity, sleep quality or sleep hygiene, stress management, mental health, And then the last is tobacco, alcohol, essentially things that are prevalent, that we're surrounded by, but that we can avoid to make sure we live a happier and a healthier life. The beauty of this is if you look at the list, each and every one of us, we can remove the last one, but the first four are things that we do on a regular basis, right? We all eat, we all sleep. I specifically put physical activity and not exercise because even to get here, we got up, we walked, so we're all doing some type of physical activity. Every single one of us is under stress. Whether we manage it or how well we manage it is a different story. And then the fifth one is kind of that variable. So the first pillar is diet and nutrition. And the Mediterranean diet is a diet I'm sure each and every one of us have at least heard of. This is the most studied diet in literature, both scientific and medical. And there's a reason behind this because this, and I hate to call it a diet, I prefer to refer to this more as a lifestyle. But this practice has the most beneficial and positive impact on our life. It helps to decrease blood pressure. It helps to improve your lipid or your cholesterol profile, which decreases risk for heart disease, heart attack, stroke. It decreases blood sugar. It decreases inflammation. I'm going to stop there for a second. We all know that these are four individual things. And in modern medicine, if you were to take a pill or some type of treatment for these, you would need one for each of these things, right? There's not a magical combination pill that will lower your blood pressure, lower your sugars, and lower your cholesterol, right? You need one kind of for each one of these things. But if we dial in our nutrition, if we are a little bit more aware and cognizant of what we're putting inside our body, specifically, trying to stick to the Mediterranean diet, it will help all of these things. And the Mediterranean diet essentially is focusing more on whole foods, things that aren't ultra processed. And I'm saying ultra processed because oftentimes, especially online, you'll hear people talk about processed foods. And I hate to break it to you, but everything that we eat is processed to some degree. So when people start throwing around the term processed food as it being bad for you, I don't necessarily fully agree with that. It's more the things that are ultra processed. But things like extra virgin olive oil, whole grains, nuts, fish, leafy greens, these are all good, what we call whole foods. You aren't going to find a lot of these things that are under the Mediterranean diet that are ultra processed. The things that the Mediterranean diet tries to minimize and avoid is decreasing red meat, decreasing sugars, and decreasing processed foods. The other interesting thing about the Mediterranean diet is that it plays a very key role in a specific protein called the mTOR protein. And the mTOR protein, what that is responsible for is it works on a cellular level to help with cellular repair, cellular growth, and metabolism and aging. Where each and every one of us are made up of billions and billions of cells, right? And if our cells aren't healthy and they're dying and they're not, living a good, healthy life, then that's what translates to organ issues, tissue issues, so on and so forth. When the mTOR protein is overactive, that increases risk for cancer, for diabetes, for obesity, Alzheimer's, and the list goes on and on. But once again, this diet has been shown in multiple studies that adhering to it not only decreases blood pressure, inflammation, cholesterol, sugars, but it also helps to downregulate that protein so it's not being hyperactive, hyperproduced, and you're not at increased risk for the aforementioned issues. So what happens with nutrition based on studies? If you start at around the age of 20, on average for women, you can add about 11 years to your life. For men, it's about 13 years. And I added this next point for a reason, is if you start at the age of 60, it can still add up to 8 years of your life. So why did I add this, right? Because usually when someone is at that stage of their life, for the most part, right, people are kind of set in their ways. There's that phrase, it's really hard to teach an old dog new tricks, right? Because as we get older, we get more set in our routine, in the things that we do. And at that point, we're like, you know what? It's worked for me this far. I'm not going to really mess with it. But this just goes to show you that it's never too late to make small, consistent, incremental changes, and you'll still reap the benefits of it. There's also been studies on plant-based diets. And if you adhere more to plant-based diets, it can add anywhere from 10 to 13 years to your lifespan. And that's also starting at the age of 20. There's been a lot of studies on intermittent fasting. And if you follow a lot of these social media influencers, this has been a very hot topic over the last 5 or 7 years. And just to give you an anecdotal story from my previous practice, I was practicing in Florida for about the last 10 or 11 years. And over the last 2.5 to 3 years, I started to keep track of my patients and their weight loss. And for all my patients, I didn't prescribe any medications. There was no Ozempic at that time. There were no injectables that were being used for weight loss. But I would prescribe individual plans for my patients with intermittent fasting. I love to eat. I love to eat. Food, I call food the great equalizer. When I'm happy, I like to eat. When I'm sad, I like to eat. So food is really a central part of my life. So for me, I don't do very well if someone says, avoid these foods. But if I restrict when I eat that food, meaning if I have a certain window during the day that I eat, I noticed that I was able to be healthier, feel better. And my patients over the last 2 years that I was there lost over 2,500 pounds collectively without any medication and solely with intermittent fasting. And that's just the weight loss portion. Studies have shown that intermittent fasting has been shown to extend life. It's been shown to cause production of stem cells. Stem cells help regenerate our bodies from injuries, whether it's a ligament injury, arthritis, what have you, tissue organ damage. It lowers blood sugar, blood pressure, blood cholesterol. Once again, there's not one pill for all of this, right? You need one pill for each one of these things. The other fascinating thing that studies have shown from the Mediterranean diet is that it's shown to cause longer telomeres. What are telomeres? I know this picture is a little bit smaller than, and there's no pointer. Okay, anyways, so that little X, the turquoise X on the screen, is our chromosomes. And within the chromosomes has our DNA, our footprints, our blueprint of our life. And at the edges, the tips of them, they have little caps. So if you have shoelaces, if you know what an anglet is the cap on the shoelace. The telomere is just that. It's a cap on the tip of the chromosome. And as we get older, and based on our preferences, our lifestyle, our diet, we can cause that to shorten more rapidly. And as the telomeres become shortened, that causes the chromosome and pretty much the foundation of our life to unravel and die more quickly. And there was a study done on this in children. And they looked at children who were obese. And what they did was, over a certain period of time, they started to measure and monitor these kids' telomeres. And they saw that obese children, their telomeres were shortening at a faster rate. It was accelerated. So essentially, children were headed towards a faster, I'm going to call it cell death, because once cells die, then things downstream die, right? But then they started implementing exercise and healthier diets. And the results, to me, I thought were phenomenal. Not only did it stop shortening the telomeres, but this study also showed that their telomeres started to become longer. So now that protective cap on your DNA and your chromosomes, not only are they staying put, but now you have more protective armor, protective shielding of our basic building blocks. Diet is super important, even in cancer. Studies have shown that eating a well-balanced diet, specifically Mediterranean diet in this sense, decreases mortality or death from cancer by 40%, and heart disease, some studies show 30, some show 35%. And we've all heard that old adage, you are what you eat. And this slide, I think, is a very, very clear illustration and representation that's grounded and rooted in scientific studies that show that what we put inside our body is one of the most important things for our lifespan and our health. Physical activity. Motion is lotion. Those of you who are my patients in this crowd, you've heard me say this before, and it's very true. If you don't use something, you lose it. The general recommendation is you want to try for about 120 to 150 minutes of moderate intensity exercise a week. Or you can do 75 minutes of something more high intensity with some resistance training 2 times a week. And the benefits, once again, it's not just one, but it's plentiful. It improves cardiovascular health, heart health, brain health, helps with muscle mass. As we get older, the ability to gain muscle becomes very difficult. And that's just a part of us aging. So putting on as much muscle as we can, both for males and females alike, is absolutely vital and important. And there are even some more recent studies over the last few years that show that we used to talk about cardio health, right? Run, jog, do all that. There are more recent studies showing that having more muscle mass actually has as much of a benefit for your heart health, because your blood vessels are, as we age, they become more rigid and they lose their elasticity. When you work out, you get more muscle mass, you work on resistance training, that helps maintaining that elasticity of your blood vessels. Ideally, you want to try to have a balance of strength and or resistance training, as well as cardiovascular benefits as well. And that can help reduce your likelihood of early mortality, early death, anywhere from 10 to 20%. Sleep. I love sleep. Sleep is number one for me. Food is probably number two. But sleep, to me, is the foundation of our health. If you are zoning out, if you are not paying attention, I implore you to just pay attention to these next 2 slides. If you're going to leave here with one message, if you're going to leave here with one thing that you want to change, this is the thing that I want each and every one of us to change. And I can promise you, everyone in this room, everyone online, we all can improve our sleep hygiene and our sleep quality. Ideally, we want to aim for about 7 to 9 hours of good quality sleep a night. And you really want to optimize the timing. What do I mean by that? Meaning you want to try to keep your schedule as consistent as possible. So you want to try to sleep at the same time every night and wake up the same time every morning. And this has a lot of benefits from a hormonal and a chemical standpoint in our body. Things become a lot more regulated, just like us as human beings. When we are regimented and when we have a schedule of when we do things, when all of a sudden something gets thrown in the mix and you have to adjust, we kind of feel a little bit off balance, right? Because you're used to, yes, sir. They do, yes. Absolutely. So the gentleman made a very good point. He said that as we get younger or as we have more experience on this earth, our bladders tend to disrupt our sleep. That is very true. There is a lot of ways to help to mitigate that, right? Unfortunately for men, our prostates get bigger, right? Surprise, surprise. So that is something that is hard to counteract. But cutting out your drinking at an earlier time at night and the rate in which you drink affects your urination. Meaning, let's say you go to bed at 10 p.m., okay? And let's say you set a cutoff of 9 p.m. and you say, after 9 p.m., I'm not going to have any liquids, okay? And let's say there's 2 individuals. One individual, from 8:45 to 9, they pound 16 ounces of water because they know after 9, they're not going to drink and they want to stay hydrated. Then you have another individual who says, from 7:45 or 7:30 to like 8:30 or 9, I'm going to drink my 16 ounces. So same amount of liquid, okay? Different frequency in which they're drinking it. The person that's drinking it at a slower rate more than likely will not have to wake up as frequently as the person who is drinking that water. So not only the timing of when you're consuming liquids will affect you getting up at night to urinate, but also the speed in which you consume that volume of fluid. So those are 2 ways to help to mitigate it. Beyond that, if there are other reasons, medical issues, whether it's a bladder issue, whether it's a prostate issue, whether it's a kidney issue, whether it's a side effect of a medication, unfortunately, that's something that you're going to have to play with and see how you can, maximize your sleep quality to the best of your ability, right? Yes, sir.
Medical issue with dry mouth. And most of the
That's, it depends. It depends. My answer to that. So the gentleman said that one of the medical issues that he talked about is a dry mouth, and like every human being, when you get a dry mouth, you think, okay, this is my body telling me that I have to stay more hydrated. I think that what you would probably need to do is evaluate your daily water intake throughout the day and assess that. And what I mean is total volume intake. I mean, what are you doing? Are you indoors all day and you drink 60 ounces of water? Or are you drinking 60 ounces of water and, especially in the summertime, you're out and about, you're doing yard work, you're playing golf? Because now you're not only losing fluid, but you're losing salt in your sweat. So replacing water in that situation is not going to keep you hydrated. It actually makes things worse, because when you lose salt and water from your body from sweat, and you replace it only with water, you're diluting the salts that are in your tissues and your blood, which can actually make you feel even thirstier. So in those instances, taking in some electrolytes will help to keep that water balance in your tissues. So I don't have a direct answer to your question, because it really depends on the individual and their total intake. And with that, caffeine intake, right? Are you taking in 3 or 4 cups of coffee or tea a day? Caffeine's a diuretic. So even though it contains water in it, you're going to be urinating more, right? Alcohol is another one. So there's a lot of other factors that you have to kind of look at, and look at the patient or the individual as a whole, so that you can get a proper understanding of their hydration status, and then make adjustments accordingly, so that hopefully, number one, you minimize any type of dry mouth or other symptoms they may be having. And number two, you try to decrease any interruptions they may be having in their sleep as well. Yes, sir.
in the 50s, they pushed salt in hot weather. Medical profession, not salt.
So, so look, as a physician, I'm board certified in family medicine and sports medicine. As I mentioned before, I was working in Florida, practicing there for the last 11 years, where Gatorade at the University of Florida was invented. I don't know any physician that understands physiology that would say that replenishing your fluids with salt is a bad idea. However, I'm not going to make a blanket statement, because if you have someone that has chronic kidney disease, of course you don't want to give them too much salt, because that can affect their kidneys. If you have someone who is very salt sensitive and they're on blood pressure medication, so it really, there isn't one size fits all in medicine, okay? But to answer your question, if someone is losing fluids through sweat, okay, it really is important to make sure that you are replacing your fluids with a little bit of salt in there. Now, take that with a grain of salt, right? Because if you walk from whatever, let's say you're just taking a stroll around your house, okay, and you're outside for 10 minutes, and you come in and you're sweating. That doesn't mean you grab 2 Gatorades and you pound both of them down, right? So it really comes down to the amount, the volume of fluid and salt that you're losing. But the recommendation right now is, if you are losing fluid through sweating, in that process you also are losing salts. And if you only replace that with water, you are diluting the salt that's remaining. And I'm using salt loosely because there's a lot of different electrolytes, salt, potassium, chloride. There's different electrolytes when we say the word salt. But you're diluting the salt that's already in your body, and that can actually not only make your thirst worse, but it can also make your cell function worse, because those electrolytes are very vital for cell health, heart health, muscle health, so on and so forth. So does that answer your question, I hope? Okay. Good sleep also facilitates the glymphatic drainage. What's lymphatic drainage? So we have a lymphatic system in our body. Essentially, it helps to clear out the waste in our body. Well, recent studies show that our brain has a separate system called the lymphatic drainage system. And the amazing thing about this system is that it removes waste and all these bad byproducts in the brain that can accumulate and cause Alzheimer's, dementia, and things of that nature. But it only works when we're sleeping. Like, look at this is why, like, for me as a physician, the more I learn, I'm always in awe of how we're created and how our body, like, works in the way that it does. Like, who would ever think that we only have a system in our brain that cleans out all the garbage and the excess and all that rubbish, but it only works while we sleep, right? This is why I said sleep, to me, is the foundation of our health. So what happens when we have poor sleep? Increases our risk for heart disease, heart attack, stroke, diabetes, obesity, obviously dementia, like we just talked about, because that drainage system, it isn't able to work. But it's really important, instead of focusing just on the quantity, it's the quality of the sleep. If you're sleeping 7-8 hours, but you're waking up tired, you don't feel rested, it's not it for you. There's something that you're doing wrong, that you're not getting the good quality of sleep that your body and your health both deserve and need. Studies show good sleep can add up to 5 years for males and 2.5 to 3 years for female. So just look at that. Every one of us in this room sleeps. We might not all exercise, we might not all eat a healthy diet, but every one of us sleeps. So imagine if starting tonight, we start to tweak how we're sleeping, the quality of our sleep, we can add years to our life by doing something that, once again, we do on a daily basis and we probably take for granted. And not to mention, good quality sleep decreases all-cause mortality, meaning anything that can cause death, by up to 30%. That's huge. Some medicines don't even give you that type of decrease in mortality, but good sleep can. Sleep is something that we all do, and it can add years to our life, and I really hope that all of us improve our sleep hygiene. I'm going to give you 4 quick tips on how to improve sleep hygiene. And I could talk about this for an hour because it's something that I'm very passionate about. Number 1, timing. We talked about this. Sleep same time, wake up same time every morning, within reason. On the weekend, you want to sleep in like half an hour to an hour. Personally, I'm okay with that. You don't want to really sway for more than that because that affects the hormones, chemicals that are being released in your brain and your body. Number 2, where you sleep, it should be a dark, cool place. Some studies show, believe it or not, that the temperature in the room for optimal sleeping, some studies have shown as low as 63 degrees. That might be too cold for a lot of people, but a cool, dark place is absolutely important for our health. Number 3, and this one is, I think, probably the biggest issue that we have in our society today, is no screen time 60 to 90 minutes before you sleep. And this is very, very important. And no screen time in bed. And I give my patients this analogy all the time. If all of us are in a movie theater, okay, and it seats 200 people, and you guys are in the last row, and I'm in the front row, we all have a huge, gigantic screen in front of us, right? The movie screen. And I'm in the front row, I'm in the bottom corner, and you're in the back. You don't know I'm there because it's dark. If I take my phone out and I start doing something, all of a sudden you're going to be like, what's that person doing? You see, it's a little square, relative, right? Relative to the movie theater screen. It's a little square, and you're saying, what's that person doing on their phone? It's interrupting my movie. Why is that happening? It's because your brain's hyperstimulated, right? Now imagine you're sitting in bed and your iPad's right here, or your phone is right here. You don't have a big movie theater screen to distract you. That hyperstimulation of that brain is going to, if it doesn't stop you from sleeping, I can promise you're not going to get a good, restful sleep. And then the last one is, the bedroom should be for 2 things and 2 things only: sleep and relations, nothing else. Personally speaking, I don't even recommend my patients to read in their bed. And the reason why that is sometimes when we do that, and we've all been there, we're tired, we get in bed, and we're exhausted. We can't fall asleep, right? I think all of us have experienced that. And why is that? It's that association. If we read in bed, if we do journal in bed, if we do some type of work in bed, no matter how tired we are, when we get into that bed, sometimes our brain's like, okay, cool. We're in our place where we do things and we're productive. I'm ready. Your body's like, I shut down, but your brain is, once again, overstimulated. Stress management. Who isn't stressed, right? Especially this day and age. Good for you, sir. That's amazing. We should talk after. Maybe you can give me some tips. But chronic stress has very detrimental effects on our health. It increases cortisol, causes inflammation. It causes telomere shortening. Remember telomeres, the caps on the chromosomes, meaning it's accelerating DNA death, cell death, organ death, so on and so forth. And there are studies that even show that when you stay isolated, it has the same exact effects as chronic stress has. And there are ways to combat this, right? Mindfulness, meditation, yoga, social support, therapy, hobbies, anything that causes you to relax, not work, anything else that causes you to relax will help in your longevity. There are studies that show that social isolation has a 30% increase in coronary disease, heart attack, stroke, and up to a 50% increase in the risk for dementia. And there are studies that show that just being positive has a positive and a resilient effect on your immune system. And our immune system are essentially the first line of defense for anything, whether it's inflammation, whether it's a cold, whether it's a other type of infection. Our immune system, they are the front lines. This shows you the benefits of just being an optimist, right? In times of difficulty, in times of sorrow, to just try to look at the silver lining and be positive. Understand that that doesn't just have a mental effect, it has a physical and a health benefit as well. And it's really amazing to see in the Japanese culture, they have a way of life. It's called Ikigai. And Ikigai translates into a sense of purpose, okay? And there have been numerous studies done on this mindset and this way of life within the Okinawan heritage. And in Ikigai, there are 4 main tenets of it, okay? 1 is, what do you love? Or what's your passion? 2, what are you good at? What's something vocationally, what's a skill, a thing that you do that you're good at? 3, what's something that the world needs? Or what's your mission? And then 4 is, what can you do to sustain, or a profession, or get paid for? You can use any type of translation for that. And it has been shown time and time again in this culture that people that have a sense of purpose have a lower rate of disease, especially cognitive disease, diseases of the brain such as dementia, Alzheimer's. And a Harvard study showed that stronger human connections, which goes against isolation, right? Those people have a better rate of survival. And then the last pillar is pollutants, tobacco, alcohol, so on and so forth. I'm not going to belabor this point. I think we all know the risks of smoking. Number 1 cause of cancer, causes COPD, lung disease, heart disease, stroke. Regular alcohol use has been shown to increase risk of cancer, even as little amounts as 1 or 2 drinks a day. Liver disease increases your risk for cardiovascular disease. Air pollutants, I think we've all seen it just even, in our community, where air quality seems to be getting kind of worse as time moves forward. This one's a little bit harder to control because we can't control outside, but we'll talk a little bit about how we can control air within, right? Our houses, our workplaces, things like that. And then an emerging field is microplastics. I think we've all seen this within the last 2 or 3 years. There's all this talk about microplastics being found in, remains of fossilized human beings from 1,400 years ago. Microplastics being found in living humans, in different tissue samples, and even in different organs as well. The beauty of these things, though, is that all of these things that I've mentioned are things that we can avoid. The choice is ours. Whether we decide to smoke or not smoke, that's up to us. Whether we decide to drink or not drink, Once again, these are choices that we're going to make. But you want to avoid these things, right? So avoiding smoking, avoiding secondhand smoke as well. So if maybe you don't smoke, but your loved one smokes, tell them, hey, quit it, knock it off. I care about my health. One way I've gotten parents to quit smoking, and I hear it a lot when they have little kids, they'll say, oh, I don't smoke in the house. I smoke outside. I would never expose my child, my infant, to smoke. I smoke outside my house. I go, okay, that's cool. My brother was a smoker. I'm like, I know something. When you smoke outside your house and you go in, your clothes smell, your hair smells, right? Your skin, your hands. Because they'll be like, oh, I don't smoke in the car either. I go, okay. But I'm like, when you go around your child and they smell that smell of tobacco, nicotine, it's an irritant. And there are studies that show that kids are 2 times more likely, infants, to have repetitive and chronic ear infections when their parents smoke. Moderate to no alcohol use. This is a little bit of a hot topic because some studies will say for women they recommend less than 1 drink a day. For men, they say less than 2 drinks a day. I can tell you, once again, anecdotally and through my experience, I've seen patients that drink 1 drink a day that come in with liver damage, with blood count deficiencies. Essentially, avoiding alcohol, just like avoiding smoking, that's like saying, okay, I only smoke 2 cigarettes a day. It's still causing damage over and over again. And the analogy I like to give, because I enjoy sports, is if we've ever seen a boxing match, right? A boxing match goes 12 rounds, okay? And if you got 2 heavyweights in the ring, and they're both doing body shots, no uppercuts, no shot, but just shots to the side of the belly, right? Everything's fine. 1st round, 2nd round, 6th round. But if that bout goes long enough, you'll hear the announcer always say something. They'll say, oh, look at it. So-and-so is losing his legs. Why? That cumulative effect, right? In the beginning, those stomach shots, no big deal. No big deal, because body is trained for this. No, coming back. There we go. All right, yeah. It's a body shot to the laptop, I guess. Right? But over time, when we chronically expose our bodies, right, whether it's our organs, our joints, we do so in an improper way. In the beginning, more than likely, our bodies are resilient. They can handle it. They'll adjust. But over time, we keep getting those body shots in. We're going to start feeling it if we reach those later rounds of life. Using clean energy, clean air filters within the house. Making sure that we check the air quality outside. And if it's bad, trying to make sure that doors and windows are closed. And then avoiding use of plastics. This is something, unfortunately, we're surrounded by. You go to the store, plastic everywhere. Plastic water bottles, right? This thing, people make fun of me, has traveled all over the world with me, has multiple dents. I do not go anywhere without my metal water bottle, because I like it. It keeps my water cold and helps me avoid plastic. So we've talked about things that we can do in our everyday life, right? Stress, nutrition, physical activity, sleep. I just wanted to end by talking about some things that we can do, because the whole point of this is to help prevent issues, right? I'm a big proponent of preventing medical issues instead of reacting to them, right? So these are things that we can do with our physicians, with our internal medicine doctors, our family medicine doctors, our nurse practitioners, whoever we're seeing, that we can help screen and prevent major medical issues. So from a cardiovascular standpoint, for heart health, right, make sure you get blood pressure checked regularly. Get fasting labs, check your sugars, your cholesterol. Get a weight and a BMI check. Coronary calcium score, it's a non-invasive test, a CAT scan of your heart that will look at hardening of the vessels of your heart. And this is done without any injection. You just go in, they scan you, and at least it gives you an idea of the vessels of your heart. For cancer screening, for women, mammogram, you want to start around the age of 45. And these aren't hard set numbers because every individual is different, especially if you have a family member, a first-degree relative that has cancer, then generally you want to do it earlier. Colon cancer screening should start at the age of 45. Earlier as well, if you have a first-degree relative, or if you start noticing that, hey, my normal regimen is not normal anymore, I'm noticing blood or something like that. Yes, sir.
I can hear that to colon cancer. So they're going every year. Is that true about your colon getting thinner as you get older and you're increasing the risk of penetration?
That's a good question. So the gentleman asked in regards to colon cancer screening and colonoscopies that in the medical profession now, after a certain age, usually the age is about 70 is the one I've seen most frequently being used. He's saying that they recommend decreasing the frequency of it and sometimes not doing it after the age of 70 because of the risk of perforation. And yes, as we get older, everything thins out. Hate to say it. Skin, everything. Like everything gets weaker, everything becomes kind of more susceptible to injury. Having said that, even a colonoscopy in a 40-year-old, I'm not a GI specialist, but I always tell patients, I go, look, you always run the risk of perforation. When you're going inside a cavity, okay, whether you're going from the top, doing an endoscopy, you can rupture the esophagus. It's not likely, but it happens, right? Just in life, unfortunately, we expect the best, but we prepare for the worst. And the colonoscopy is no different. At that point, it really comes down to the discussion that I'm just going to use me, that I would have with my patient, okay? If they're a high risk, then I would say, listen, this is my recommendation. If their brother, dad, mom, whatever, let's say colon cancer runs rampant in their family, and they've also had abnormal colonoscopies in the past, I would say to be as close to 100% as certain as you can be, a colonoscopy is going to be your best bet. Because nothing can substitute visualizing with our own eyes, meaning a physician's eyes, and taking a tissue sample. A Cologuard kit, which I mentioned up here, is something that's very often used, especially in patients who are a low risk for colonoscopy. I'm sure we've seen the commercial of the little white box dancing and smiling on TV, right? They mail it to your house. You have a bowel movement in the comfort of your own home, follow the instructions, pack it up, call UPS or FedEx, and it goes, and it's about 98% accurate, okay? But it's still not as good as a colonoscopy. Yes, sir?
How in that, yes, I understand the risk of social medicine. They do not pay, they do not. Here's cases of doctors. The variable of accuracy broad.
So it's a good question. The gentleman asked about about PSA testing. Personally speaking, I have gone away to just testing PSAs on all my male patients, okay? Because there are a lot of things that can cause a false elevation of PSA outside of prostate cancer. I don't want my male patients to have to undergo unnecessary biopsies of the prostate, which are very painful and oftentimes come with long-term side effects, okay? This is where medicine has to be individualized. You talk to your patient, you ask certain questions, you risk stratify them, you see are they having symptoms that would put them higher on your list for prostate cancer. In those instances, then yes, I would order a PSA because I'm using my clinical judgment along with the test, right? Because in medicine, we should never treat a test, and we should never treat an image, right? These are tools that we as physicians use to help confirm or rule out, and then help guide us in our treatment of that patient. So I'm of the mindset, and I'm of the state of mind that I don't do them, because we used to do them all the time. Over the age of 50, bam, part of your labs for physical, PSA, and I've gone away from it unless they have symptoms where I feel like their urinary tract is being obstructed, and I feel like it's being obstructed by their prostate. Because if they check, symptoms A, B, and C, and I check it and it's elevated now, all of a sudden, instead of being like 40% just based on a PSA alone, now all of a sudden my suspicion's up to maybe 80% or higher. And then for smokers, a low-dose CT scan. A lot of people aren't aware that there is a screening tool for lung cancer, and this is the tool. It's a low-dose CT scan. Generally, it's for ages 50 and above, or if you have a 25-pack year history. How is that calculated? It's very simple. If you're a smoker, what you do is you take your average smoking in a day. So let's just hypothetically say patient says, I smoke 1 pack a day. and I've been smoking for 30 years. So you do 1 pack a day times 30 years gives you 30-pack year history. They qualify for a low-dose CT scan, and they get that scan. And this is looking for mass, for nodules, growths, and things of that nature. And obviously, all of these things are great, but nothing can ever substitute a physical exam. Seeing a doctor, seeing a healthcare provider, having them listen to you, evaluate you, hear, because all your numbers could be great, and if you put that stethoscope on someone's chest and you hear something, a valve disease, their valve is about to rupture, that won't get caught on a cholesterol panel or a sugar test, right? So getting yearly physicals with your doctor is very important. Labs, weight checks, blood pressure, things that I mentioned before, are all good tools to help prevent mortality and morbidity. You know, the whole point of today is to hopefully show a more integrative approach to medicine, right? Is with every person that comes to see someone, they should have a precise approach that takes into account their lifestyle as well as the use of medications, because let's be honest, we all wouldn't be sitting here without medicine, right? Medicine has a role in our health, and a good role, but I don't think it's the starting point personally, and I don't think it's the end point either. And nowadays, we have a lot of new technology that will help monitor things that we talked about earlier today. Like, for instance, we have sleep trackers now, right? Although they are imperfect, and if you got 5 different sleep trackers, they all will give you 5 different data on how you slept. And that's fact. You can look all this up. I've really gone deep into sleep because, as I mentioned before, sleep is the foundation of our health. But at least it's something, right? It's something measurable that we can use and we can track to see, okay, if I'm watching TV in bed and my sleep tracker is saying that I'm waking up 6 times at night and I'm not getting into REM or that deep sleep where our body really is able to regenerate, recover, and make ourselves feel better. And you stop watching TV in bed for 3 months, and then now your tracker says, hey, you're only waking up 3 times and you're hitting REM really fast. Even if it's imperfect, at least you have a starting point and you've made a change, and now you're seeing a benefit from it as well. And my goal personally is always to give a personalized approach to my patients, considering their biology, their lifestyle, and genetics. Because I'm not going to treat someone who owns their own business and has 20 hours of free time to exercise and do everything else, compared to my patient who is a truck driver. He's on the road for 17 hours a day, and he doesn't have access to home-cooked food, right? You have to adjust. Like I mentioned before, one size does not fit all. So how do we implement change, right? It's great. I gave you all this information. I gave you tools. How do we implement change? My humble advice to you is to start small. Start small. In ancient Arabic tradition, they say that the most beloved and difficult actions are ones that are done consistently, even if they're the weight of like a grapeseed, meaning very, very, very small. Why? Because consistency is always the hardest thing to do in life, right? Whether that's with family, with friends, with working out, with eating, being consistent is always the hardest thing. We'll do great for a few weeks, a few months, and then we might fall off for a couple of months. But start small. If your diet is a main issue, and let's say you're eating fast food 3 times a week, don't say, I'm going to quit fast food, I'm never going to eat fast food again, because more than likely you're going to fail. But say, you know what, for the next month, I'm only going to eat out twice a week. It'll be a treat. Because that way, when you do it, believe it or not, there's neurologic benefits to that. Because when you set a goal, regardless of how small it may be, when you attain it, your body starts to release dopamine. And it releases serotonin. And there are studies that look at functional MRIs, like live MRIs of this. And when you do that, you feel good, right? I think whenever we set a goal and we reach that goal, we have this feeling of like, oh, this is a good feeling. Even if it's something as simple as like, I got to make my bed, right? But that motivates you. And neurologically, it helps to get the more difficult tasks done. And once again, and I always start with, there's a study on this, and there's a study that shows that if you have really, really difficult tasks, okay, whether it's work or whatever, the best way to get it done is you make a list, okay? And I've tried this, and it is really strange how fast this works. But you make a list, and you start that list with really, really simple, mundane tasks. For instance, wake up, make my bed, brush my teeth. Things that all of us, I hope, are doing, right? On a daily basis. But when you get to that thing where it's like, okay, let's say you're writing a book, it's like work on the next chapter of the book. When you get to that task that's really, really, really difficult, you're already ready for it. Why? Now, in your brain, when you look at it in an itemized way, you're like, I just did all these things that are like, I do every day anyways. But your brain doesn't know that. Your brain just knows, okay, make my bed, I crossed it off, dopamine. I feel good. Okay, I got to brush my teeth, cross it off, more dopamine. Man, I feel really good now. Now when you get to that hard thing, it's no problem. It's no problem. And this is a good acronym to use when you're referring to goals, is you want to be smart about it, right? Specificity, super important. If you're just like, if you leave here and you're like, I'm going to be healthier, what does that mean? What does that mean, right? Be specific, right? Something that's measurable. The fast food example I gave, you eat out fast food twice a week. You smoke a pack a day. You say, you know what? Starting today, I'm going to cut down to half a pack a day. It's something that you can measure and monitor. And this also ties into, from a brain perspective, neurologically, when you start doing that and you're hopefully successful, your brain releases more dopamine. Something that's achievable, right? If you are struggling with, you haven't worked out in 10 years, and you say, I'm going to do a marathon in a month. I'm sure you can do it. And that's amazing, right? You might be seeing myself, one of my colleagues, for knee pain, but you want to make sure it's something that's achievable once again, because as you achieve those things, no matter how small they may seem to you, from a brain perspective, it pays off really big dividends. Something that's relevant. Obviously, you want to make sure it's relevant to your health, to your life. And it's something that's timed. Give yourself a time period, right? 3 months, 6 months, whatever. And it's very important to reassess. And this is something I think that in human nature, each and every one of us kind of is afraid of. And this is why with my patients, especially my patients that are trying to work on either fitness, whether it's strength or weight loss, I always say, I'm going to see you back in 3 months, whatever, X amount of time. And I promise you, the patients that come, even when they come not successful in their endeavor, they're successful long term. And this is anecdotal, but this is based on my experience, because there's that accountability, right? It's like if you go to school and your teacher says, okay, first day of class, here's a stack of your work, make sure you get this all done. There's going to be a final at the end of the year, and they never collect anything, they don't check anything. You're not going to do it, right? Small minority, sure, people that are super hardcore, motivated, self-disciplined, but the majority of us, after the first month, we're going to be like, wait a second, I did all these worksheets and this, and it's just sitting here, well, okay, I'm busy this week, I'll do it next week, and then all of a sudden, 3 months have passed, and that final exam comes, and you're like, I don't know anything. But reassess, biomarkers, labs, check levels, sugars, cholesterol, so on and so forth, your weight, strength, whatever it is that you hope to achieve, make sure that you're able to reassess them, they're measurable, and you can see your progress. And then you can also make adjustments as necessary. If your goal is to lose 12 pounds in 3 months, right? That's a pound a week, incredibly doable, and that's something I recommend to everyone who's looking to lose weight, something sustainable. 0.8 to 1 pounds a week is ideal. And this is based on numerous studies. It is achievable, it's sustainable, and it's a good, healthy way so that your body doesn't go from being in one extreme state to another extreme state. So just to summarize what we talked about, I started this off by saying, talking about how we've increased lifespan in this country, but our health span, meaning our chronic diseases, isn't keeping up with it. So we should work on not only extending our life, but quality of life, right? Because what's the point of living longer if we're not living healthier? And remember the pillars: nutrition, exercise, sleep, mental health, mental wellness, avoiding toxins. And understand that there's synergy with these pillars, right? When you build a structure, a house, a building, whatever, that foundation works together, even if it's not connected. And these pillars are absolutely no different. Remember, small wins make a big impact. From a mental health standpoint, when I deal with patients who struggle with, for instance, depression, I always tell them, I go, we are all surrounded by I call them the small W's in life, okay? I'm like, a lot of times we take them for granted. But if you acknowledge them and you actually consciously identify them, once again, that dopamine goes up, and you feel like you wake up in the morning, and I'm sure a lot of us don't do this, but I have a roof over my head. I'm sleeping in a bed. I don't have to worry about where my next meal comes from. I have clothes on my back. These are all small W's in our life. And unfortunately, we've been programmed to not acknowledge them, and we just come to expect it, right? This is why acknowledging small W's is such a key component to living a healthier life and being happier as well. And I hope that this short talk has motivated us to take control over things that we absolutely have the capability to change within us. Because we all hear diabetes, heart disease, cancer. I've given you stats on how sleeping, nutrition decreases the risk of cancer. Because some people say, oh, well, cancer runs in my family, so it's just going to happen to me. And you know what? Unfortunately, that might be the case. But there are things that we can do to mitigate it and to decrease the chance and the likelihood of that happening. And ideally, I hope each and every one of us here and online, it just feels really weird to say that, but I hope that we all leave here and we leave with a new perception and sense of medicine, where we want to bridge, right, traditional medicine and science that we do have, and this concept of, people call it biohacking. I don't like that term, but it's being used a lot. But lifestyle changes, things that we do on a regular basis to help maximize our health, decrease the medicine that we need to take, and in turn, it will decrease any type of side effects or complications that we may have from these medications. I appreciate everyone's patience. Any questions, comments, concerns?
There's a question online.
Okay.
Are there specific types of exercise you recommend for bone, heart, or brain health?
Excellent question. So it goes, I'm just going to go back to that slide if that's okay. That way, yes. So the answer is it's a balance of strength or resistance training, and that's where you'll hit muscle health, bone health. If you have a hard time with maintaining your blood sugars, resistance training, your muscles need sugar. It's the main fuel source for muscle activity. So when you increase physical activity, whether it's cardio, running, biking, or weight training, your body is naturally going to pull sugars from your blood into the muscle to help fuel it because it knows that the demand is higher. Cardiovascular for heart health and brain health, doing some type of cardio. Now, cardio, people hear cardio and they say, I hate running. Sweet, I hate running too, unless I have a purpose. Police are chasing me, I will run. You throw me on a court, I will play sports. I just can't run for the sake of running, right? But you can do cardio with resistance. So people often, things are not mutually exclusive. You just have to get a little bit clever on how you tweak things. So for instance, if you want to hit everything and your time is limited, you can do weight training, but just make sure you're doing higher repetitions and lower reps between sets. Because that way your heart's going to be pounding because your muscles are going to be working extra hard. Now, if you're sitting there between sets and you're, texting, checking your timeline, your heart rate comes back down and now you're back to square. But if you say, okay, I'm going to do push-ups, and you do whatever push-ups, and you say, okay, I do 10, and you stop and you feel that heart pounding, and you're on your knees and you're kind of breathing a little bit heavy, and then you say, okay, 30 seconds, bam, you go back again. And you're not going to hit that same number. That's okay. You're getting that resistance and strength training, and you're coupling it with cardio. That way you're hitting brain health, heart health, you're helping your joints, you're helping your muscles, and you're helping your bones as well. And the other key thing is with weightlifting, resistance training, I don't care how much you can bench, I don't care how much you can lift, all of that stuff is meaningless. If you can't control the weight throughout, that's not a benefit to you. If you want to maximize strength, muscle hypertrophy, recruitment of muscle cells to gain muscle growth, and to protect your joints and ligaments, you want to control the movement throughout. So for bench, when you're lowering it, don't let gravity do that work. It should be a nice controlled movement. When you're at that peak drop on a bench, hold it for a second or two, and then an explosive push out. That is the optimal way to get muscle hypertrophy and also to protect your joints and your ligaments and tendons as well. I saw another hand go, yes. I love intermittent fasting. So this young lady asked me what my opinion is for intermittent fasting. I think intermittent fasting is great. I do. If you look at humankind historically, we were not meant to eat throughout the day. And unfortunately, because of ease and accessibility, I feel like we've really gone into excess in consuming things. It depends. Intermittent fasting can be tough for some people. I think that ideally, if you can regularly stick to a 16 and 8 window, that is great. And I'll explain that for people who aren't familiar. So intermittent fasting is where you pick a window during your day in which you can eat. And to illustrate it, I'm just going to use 8 and 16 to kind of keep things simple. So there's 24 hours in a day. So let's say you say, I'm going to pick an 8-hour window in my day. So just for example, say from 11 a.m. to 7 p.m., that is my window to eat. So that means from 11 a.m. to 7 p.m., you can eat, and I mean eat healthy. I mean, if you're sitting there and, I love Oreos, you pop in Oreos and donuts and all these things, you're undoing it. But you eat healthy, right? So like the Mediterranean diet, so lean meats, fish, chicken, whole grains, legumes, nuts, green leafy vegetables, fruits. You eat it in that window. Outside of that window, so in our example, 11 to 7 is our window to eat. Outside of that window, you can't eat anything. However, you can drink all the water you want. You can have black coffee, tea without sugar. The whole point is to stay in a fasted state. So outside of whatever window you choose, you want to keep your calories to 0. For my patients in the past who have had a difficult time kind of adhering to it, I go, that's okay. Start with a 10-hour window, okay? So you pick a 10-hour window instead of 8. So 10 hours of eating, 14 of fasting. Do that for 2 weeks. And then make it a 9-hour window. And then I can't tell you how many of my patients, I had patients in their 70s. I still remember her from my practice down there. She lost 70 pounds in 6 months. 70 pounds, and she's like, my knee pain went away. And I'm not trying to, I don't want you going home and being like, oh my God, this doctor said that if I fast. No, I'm not. I'm just sharing these stories with you to show you how just a healthy life, a healthy nutrition, healthy body can have amazing effects on everything, whether it's muscle, joint, heart, kidneys, all of that. So if you can't do 8 and 16, I recommend doing 10 and 14. And if that's too hard, I say, okay, do 10 and 14. And in that 14, fine. If you want to cheat, maybe cheat healthy, right? So cheat with like some almonds, some pistachios, and then slowly taper that down, right? Because we get really used to what we expose our body to. So when we make abrupt change like that, it's very hard for us to be successful. My goal is to give people, goalposts that they can reach and not make it too difficult for them, because I want them to be successful long term. And if that means doing this over a couple of months, no big deal, right? We usually don't get sick in a week, right? Or we don't get overweight or whatever in a month. So I tell patients, look, you are in the state that you're in, whatever that case may be, because of months to years of maybe poor decisions, being a little bit more relaxed. So we have to take that mindset and apply that to getting healthy, right? Because a lot of times, once again, being in this instant gratification society, we're like, well, I did it for a month, nothing worked. I'm like, I had a patient who was a nurse, and I remember she's like, I want medicine to lose weight. And I go, no. I'm like, look, we're going to do this together, okay? You're going to fast. And she came back 6 weeks later, and she was on 2 pounds. I will never forget this. She was on 2 pounds. And I was like, what happened? She's like, I've been fasting. I'm like, okay. I'm like, you've been fasting? She's like, I swear. She's like, I'm even doing 16 and 8. I'm like, that's interesting. I hadn't seen this before. I'm like, okay. So then my next question was, what are you eating in that hour? Oh, I like donuts. I'm like, come on. I'm like, I'm not making this up. Like, that's where she started. And I was like, and then she looked at me. She came back 6 weeks later. She was on 12 pounds. And it wasn't that she gave up donuts forever, but it was like, okay, once again, it was a treat. Once a week, I'm going to have it. And then after some time, when you start to minimize things that might not be good for you, right? You start to feel better, all right? You start to feel better. There's a word in the fasting community. and I've been doing this for years now, and you get this mental clarity, and it's very hard to describe. But like sometimes you might feel tired or mentally fatigued or foggy. Fasting somehow gets rid of it, and there are some theories behind that. When we fast, it actually helps our body detox, get rid of all those toxins a lot more quickly. But I hope that answers your question. Okay. Any other questions, comments, concerns? And it doesn't have to be directly related to this. If I can answer it, I will. If not, I will very kindly deflect. So. All right. Well, I really appreciate everyone being attentive and for participating. I hope this was beneficial to you, and I wish you the best of luck moving forward. Thank you.